At this time last year, the novel coronavirus COVID-19 was merely a blip on the radar, noticed and being watched, but as something happening elsewhere. Fast forward a year, and we are nearing 500,000 deaths in the United States alone, attributable to this pandemic, and tens of millions infected, many with lingering health issues. Dr. Mathew Logan, Chief Medical Officer and VP of Medical Affairs of Self Regional Healthcare, is on a mission to inform the members of Greenwood County about the current state of COVID vaccination. Thank you, Dr. Logan, for joining us this morning and working tirelessly as a member of the medical community to help us through this crisis, even when there's so many unwilling to accept its seriousness. So what I'd like to do is turn it over to you. You have a small presentation you would like to give our members today.
Yes, and thank you for having me today. And really, I just want to kind of get the word out. And I thought what I would do today is just share with you some information from our community, from Greenwood and the areas that Self Regional serves, and kind of walk through the history from the beginning of the coronavirus pandemic up to today. Kind of share some statistics and a little bit of data from our hospital, what we've been seeing here, as well as to talk about vaccines. And certainly I'll try to answer any questions that may be out there as well.
Yep, we received a number of questions, people interested to get some information from you. So let's kick this off.
All right, great. All right, so we'll start with kind of an overview of where infections have been from the start. Back, about March or so was when we first started seeing infections show up in our community. And this slide basically is from DHEC, and it shows the number of infections by day that were identified through testing since the beginning of the pandemic through just a couple days ago. The green line is a 7-day moving average of the number of infections. And you can see we had a peak around August, and then there was a little bit of a lull. And then after the Thanksgiving, Christmas holiday season, we just had an influx of COVID positive infections in the community. Fortunately, we've seen it come back a little bit, and I'll talk about that in just a minute. Currently, as of this morning, this is February the 5th, as we're discussing this, we have had, today we have 42 COVID positive patients currently admitted to the hospital. 9 of those are in the intensive care unit and 6 are on the ventilator. To date, since the start of the pandemic, we've had 162 COVID-related deaths at our hospital and 984 COVID admissions. Self Regional is doing a pretty good job managing this population. Overall, we've had a 16.5% death rate. Basically, what that means is that if you're sick enough to have to be admitted to the hospital, about 16.5% of the people that get admitted with COVID diagnosis end up succumbing to it. The state average is 18.7%. That data is from South Carolina Hospital Association. So relative to other hospitals in the state, we're providing as good or better care here at Self Regional as any of the other hospitals. Some of the things we did to try to manage this population, again, fortunately, we're down to 42, and that's still a lot of people who are sick with it. But about 3 weeks ago, we were in the mid-80s. We had up to, I believe, at 1.85 inpatients with COVID at our peak about 3 weeks ago. We had to do some things to help accommodate this large number of patients. We combined 2 of our surgical floors, floor 3 and 4, and moved all those patients to the 4th floor and opened up 3 to provide care for medical patients, as well as some of our COVID positive patients on one wing of that floor. In addition to that, since the start of the pandemic, we have dedicated one entire floor of the hospital to care for COVID inpatients at the hospital, in addition to our intensive care unit. Our ICUs have been full recently. Fortunately, again, we've seen those numbers come down some in the last week or two. But about 3 weeks ago, every one of our ICU beds was full, with about half of those ICU beds with COVID positive patients. We did move our pediatric floor to a different part of the hospital to open up an additional ICU overflow area, which allowed us to open up more ICU beds to care for our really sick patients. Just for reference, we normally would have 30 ICU beds available to care for our sickest of patients, and we expanded that to 46 at our peak because of the influx of patients that we saw here. On the medical side, our teams here have participated in a bunch of different conferences around the state through the South Carolina Hospital Association, just to ensure we're providing the latest treatment for COVID in the hospital. Currently, it's a combination of remdesivir as well as steroids, which are just some of the treatments that are currently used for that. Dr. Lincoln McGinnis is the medical director of the hospital service. He's been really awesome in helping manage a lot of this patient, him and his team, our hospitalist team, on the inpatient side. And he and I participated with a conference with the Medical University of South Carolina's COVID task force as well just a few weeks ago, just to kind of compare where we were with their treatments. And it's really amazing. We kind of are doing the same thing. So we feel that we're providing really state-of-the-art healthcare. And so we are here to provide care for the community, and feel like we're doing as good a job as can be done for this sometimes really sick population. This next slide that I'm showing you here, basically on the top, this top graph shows the number of admissions by month since March. So you can see in March we had just 3 COVID admissions. So 3 of the patients that got admitted that month had tested positive for COVID. We had that peak in August, and then fortunately things kind of came back down. In the middle of August, we thought we were just overrun. It was like, goodness, we just could barely keep our heads above water. And then we were so glad to see that lull. And then what happened in November and December, you know, it just is part of living. Folks want to get with their family, and I understand that. But unfortunately, folks, as they got together more, and I honestly think just the fatigue of having COVID going on for so long starting to wear on people. And I think we let our guard down a little bit, and we have had a very significant surge. You can see in the month of January, we had 235 admissions to the hospital with COVID. And January also was our highest month for COVID-related deaths, where we peaked at 50 deaths during the month of January. When you look at the overall picture for the month of December and January, we had 425 admissions, which accounts for 61% of all the admissions that we've had since the start of COVID. I just say that just to point out that it's not over. It's not fake. Our nursing staff, our physicians here, our the medical assistants, to the EVS workers, everyone who's here is working really hard to help care for these patients. And it's tiring. The medical staff here is tired. We're trying to do the best we can and kind of keep our heads above water, but it is wearing on the staff from an emotional standpoint as well. To have that many people die during a single month or two is very emotionally draining, particularly when you're given 100% to try to help these folks. So again, I just really wanted to say this piece of it, just to say COVID is real. It's not fake. There's a lot of misinformation on social media that I see on Facebook. It just kind of makes me sick when I know people read that and will believe those things that may be floating around, that it's some type of a conspiracy that's not real. But I assure you, it is real. And we've seen a lot of it here, and a lot of people in our community have been affected. So what can we do to try to help get on the other side of COVID? Right now, we're still in that phase of prevention. So we still need to wear a mask when we're in a public setting, or when we're around others outside of our home, wash our hands frequently, and keep a safe distance, at least 6 feet from others not living in our home as much as possible, and try to avoid large gatherings, particularly indoors. And then the other big thing is vaccines, and vaccines are here. We received or started giving COVID vaccines on December 14th. It was our first day. And we started with our medical staff. We are following the DHEC guidelines. DHEC is very strict with who can get vaccine and when. And the first group to be vaccinated were healthcare providers. And so we really we focused on vaccinating our hospital staff to start with. And then within just a few days, we expanded that to any healthcare provider within Greenwood and the surrounding counties. to include the dental community as well as any private practices and their staff. And so we were real successful with that rollout. And then just a few weeks ago, the governor decided to go ahead and move the 70-plus-year-olds into phase 1A, which is, again, where we are as of today. And I'll give you our numbers. As of yesterday, we have vaccinated 16,171 injections, and of those, 12,891 individuals. It's a 2-dose vaccine. You give 1 dose, and then of the Pfizer vaccine is what we're giving here. They give the first dose, and then 3 weeks later, plus or minus a little time, there's some leeway on the second dose, you give that second one. So we've administered a total of 16,171 vaccines. Of those, 12,891 are unique individuals. So we are very glad to get that out to the community.
Dr. Logan, I will share that I've received some feedback from some of our elderly members who have gotten vaccinations, and it has been nothing but praise. 2 things. One, nobody's experienced any significant side effects. Just a little soreness is what has been reported so far. But probably the most important thing is that just the logistics has been so smooth. They were waiting, they were expecting long wait times, big lines outside. They saw none of that. They thought the whole organization was smooth, and hats off to you and your entire staff for putting together a very easy mechanism for them to receive that vaccine.
Thank you. We've had a really strong team working on that whole process, and from pharmacy to some of our logistics teams as well. So I think they've done a good job, trying to make it as easy as possible. We had an event here a couple Saturdays ago where we had some more vaccine than we had anticipated that week, and so we held a weekend event. And on one day, we did over 1,800 vaccinations on that one day, and it was amazing to see kind of how we got people through. I think the longest wait there was a little over an hour that day from the time of arrival through the whole process and on the way home. And part of that's an observation period. After you receive the vaccine, you have to stick around for 15 minutes just to be observed.
Right.
So I want to show you this next slide. I know there's some hesitancy from some about the vaccine, or does the vaccine even work? I just try to make this simple. This is this is directly from the Pfizer study. The writing on there is not from the Pfizer study, but the graph is. The blue line at the bottom of this graph basically shows. You can see basically the bottom line shows the vaccine. So those that got vaccinated, this is the incidence of COVID infection in the placebo group in the red dots. And then in the blue dots is those that got vaccinated. And you can see a really sharp disparity there around day 12, where the incidence of COVID infection is dramatic. It's a dramatic difference from folks that got the placebo to the real Pfizer shot. And so I share this just to show the vaccine is effective. It's 95% effective in preventing COVID infection approximately 1 to 2 weeks after the second shot. And that's from a study looking at 44,000 people and during the study trial. The Moderna vaccine has a very similar graph. This is the Moderna vaccine graph. In Greenwood, the hospital is currently giving the Pfizer vaccine. That's specifically because we have the ability to store the Pfizer vaccine at negative 80 degrees Celsius, which is really requires some special freezers to be able to accommodate that. In fact, we did not have those freezers initially, and we partnered with the Greenwood Genetics Center to obtain those freezers to be able to store the Pfizer vaccine that cold. And we're very grateful to that partnership with the Genetics Center. They loaned us 2 of their large negative 80 degree Celsius freezers that we've been using for this purpose. The Moderna vaccine can be stored in more normal freezer conditions and doesn't require such a cold environment to maintain it. So the Moderna vaccine is used in other locations and at the hospital close to those freezers. So the Moderna has been used primarily in the long-term care facilities, as well as in other locations. There are some pharmacies here in town that are starting to administer vaccines. I know that Publix has started. I understand that CVS is starting. I'm not sure if it's this week or next week. And also, this is the vaccine when DHEC does an event like in our community to provide vaccine in the community. They use the Moderna vaccine as well.
So if I may ask at that point, so we're seeing a broader distribution of providers giving the vaccine. Do individuals call Publix directly to schedule an appointment? Do they call, Walgreens? What's the best way for them to get into the queue if they qualify?
Sure. I've been looking at that a little bit. It looks like the majority of those are online registration forms for specifically, I know Publix is an online registration form. DHEC, I believe they have a call number as well as some online options to register for those events.
Okay.
So anyway, there are other options besides self-regional. Certainly, we I think have given more than any other entity in our community, but we certainly are glad to partner and give as many as we can. Just again, a common question about side effects that you mentioned that a minute ago, just to talk about that. It's similar to other vaccines. The most common side effect is muscle soreness at the injection site. Others include feeling tired, headache, joint aches, possibly some fever. Most symptoms go away within 24 to 48 hours, and it's more common after the second dose of vaccine. I know when I had my vaccine as a healthcare provider, I've just had a sore shoulder for a couple of days. That was basically it, and that got better, and it was the same thing on the second. We have heard of a few of our team members here at the hospital that had more significant side effects, such as kind of body aches or joint aches or just not feeling good for 2 or 3 days. But all of that resolved with some time, and no one's had any major adverse reactions. The safety profile of the Pfizer vaccine that we're administering is similar to influenza vaccine. It's a little more, perhaps a little bit more risk with the Pfizer vaccine than the flu. And so when I say that, the numbers are like 5 out of 1 million people who get injected will have anaphylactic type reaction. So it's not like large numbers of people are developing anaphylaxis or having these severe allergic type reactions. Where the flu vaccine is somewhere around 2 out of 1 million will have that type of reaction. So it's thought to be extremely safe. It's a possibility, but it's unlikely. And when we administer vaccine, that is part of the reason why we have a 15-minute observation period after we receive the vaccine to watch for any type of allergic reaction. We also have trained nurses as well as physicians on site at our vaccine location. And we have immediate access to anaphylaxis kit, which includes things like an EpiPen, steroids, and those type medications that if we were to encounter that type of anaphylactic reaction, we can immediately treat it right then on site. So far, so good. Out of the 16,000+ we've given, we have not had any reactions like that here yet. So we'll hope that doesn't happen, but if it does,
I'll take those odds for sure.
Yeah, for sure. Just a couple more things about the kind of the rollout of the vaccine. To some, it may not make sense why we started with the 70-year-old to 65-year-olds, but just for information, statistics from the CDC show that 65-plus-year-olds account for only 14.3% of all COVID positive infections, but they account for 81.2% of the deaths. So if you think about that, it makes a lot of sense to start with that, with the older population, to try to really get them immunized as quick as we can and keep them from getting infection and keep them from dying. They are at higher risk. So I just thought I would want to share that with the group as well. So definitely important to get that group vaccinated first. It makes sense. Some myths about COVID, and I'll just share this with the group as well. These are common things that I hear. COVID-19 vaccine, it contains this RNA stuff and it may mess up my DNA. It's just not true. RNA, when you're injected with the vaccine, what happens is it's basically an RNA, which is not DNA. It's a single strand of RNA, which enters the cell, and it kind of uses the ribosomes inside your cell to code that RNA, and it codes for a protein. That RNA is gone out of your system within about 6 to 8 hours, and it's completely gone. And that protein is left behind, and that protein is what gets released into your kind of your bloodstream, and where your antibody response comes from. RNA cannot enter inside the nucleus of a cell. It is a one-way street from DNA. In normal situations, the DNA codes for RNA. RNA exits the nucleus and does not go back into the nucleus. And the RNA in the Pfizer vaccine cannot enter into the nucleus where the DNA is housed, so it's impossible for it to alter the DNA. It's just not true. Another common myth or things that we hear a lot is it isn't safe because it was rolled out too quickly. Our RNA vaccines may not be safe because this is a new type of vaccine that's never been used before. While it is true that RNA vaccines have not been used before, RNA specifically has been used in other treatments. And for example, in certain cancer treatments, going back to around the year 2000, 20 years ago, RNA was started to use in a vaccine form to treat certain cancers. So there's a lot of experience with RNA injectables to help provide an immunity to something, or to get your immune system to like attack a certain thing, whether it be a cancer cell or whatnot. And they basically have used that same technology and applied it to a vaccine, and used that one single strand of RNA from the virus that codes for the protein that kind of the spike protein of the virus that is where the attachment to the human cell comes. And by coding for that protein, we can get our immune system to recognize that as foreign, develop antibodies against that protein. So when you get the real virus exposure, you have an antibody sitting there ready to go to take it out. So the vaccine did go through the processes relatively quickly. However, they went through all the processes. They didn't skip a step. There wasn't a safety step that was skipped. They went through phase 1, 2, and 3 in a trial of over 44,000 people in the phase 3 trials, with a very amazing response to prevent infection, as well as a very safety. The safety of the vaccine was shown well throughout the whole time. Another common thing that you hear about, or at least questions I get, are, well, I have an egg allergy. I can't take the flu shot because I have an egg allergy, or I'm allergic to peanuts, or other people are concerned about breastfeeding or pregnancy. Well, the fact is that the Pfizer vaccine is safe for those who may be immunocompromised. If you have egg allergies, it's fine to take it. There's no egg in the Pfizer vaccine, or the Moderna vaccine for that matter. The American College of OBGYN, it does recommend that the vaccine is safe for pregnant as well as breastfeeding patients to get. Here at SELF, we're recommending that you do talk to your OBGYN doctor before receiving the COVID vaccine to see if it's right for you. But there's no reason to think that it would not be safe. And then other people think they may get COVID from the vaccine. Now, again, that's not true. You can't catch COVID from the COVID vaccine. Again, the COVID vaccine only has one strand of RNA, which only codes for that spike protein. When you get infected with COVID, you get like 26 strands of RNA from the virus, which codes for the whole viral particle. And you can get it from that, but you cannot get COVID from that one strand of the COVID vaccine RNA. And so the other thing as well, people have said, well, I had COVID, so I'm immune to future COVID infection. Well, what we know about that is that the immune response from having COVID infection is probably going to last 3 to 6 months. We do know that the antibodies start to wane around 3 months or so, but we do think that most folks will have some protection from future COVID infection for at least 3 to 6 months after having contracted COVID. So what the general recommendation is, when supplies are really low with COVID vaccine, the recommendation is, well, you had COVID, so wait at least 3 months before you get the vaccine, because you should be protected for that 3-month period. However, you can go ahead and get it, and I would recommend that folks, if they do qualify within their age range, so currently as of today it's 70 plus, starting on Monday that will move to 65 plus, to go ahead and get the vaccine if you're out of your quarantine period. During the Pfizer study, they found that actually being vaccinated developed a much stronger antibody response than actually contracting COVID itself. And the antibodies lasted longer than contracting COVID itself. And currently, we don't know exactly how long that immunity will last. They're continuing to follow those in the trial. I was fortunate to be able to participate on a conference call with Tim Mullinex, who was the medical director of Pfizer vaccine. This was through the South Carolina Hospital Association a little over a month ago. And one of his observations was that the vaccine response of about 8 to 9 months after some of the initial people had it, they still had a very strong immune response, or still very large antibody titers. And he's estimating on that call that it will probably last 1 to 2 years before you might need a booster. So that's often another question people ask. So again, we don't know for sure yet. It may be a once every other year type booster. It could be a once a year booster similar to the flu shot. So the jury's a little still out on that. The other question that people often ask is, well, if I get the COVID shot, can I go ahead and quit wearing my mask? And to answer that question, really the answer is not yet. We have to get to a herd immunity level. Even at 95% effective rate of the vaccine, there's still 1 in 20 people who are vaccinated that may contract COVID. So you can see it's not 100% yet, but as more people are vaccinated, you really do get to that herd immunity, and you read different things online, but it's probably around 70% to 80% of the people who've either had COVID or have been vaccinated once we kind of can reach that herd immunity level and kind of come out of the mask for good. I know we're all looking forward to that. I know I certainly am. Again, just kind of who's eligible for vaccine right now. All healthcare personnel, anyone who currently lives in a long-term care facility, and then in South Carolina, starting next Monday, anyone who is 65 years and older has been moved into Phase 1A, which is where we are right now. So we're at Self Regional. We're starting on Monday to vaccinate the 65 year and older crowd. So we're excited to move into the next phase. It's really interesting. When we first started with opening up to 70-year-olds and older, we had this huge influx of people that just wanted that vaccine so bad. And it took us a little while to work through that. But the current week that we're in right now, the demand has really kind of waned. And so we're excited to open it up to 65-year-olds so we can really kind of get it out again. So we're gearing up right now to get ready for next week. And we're planning on being able to do up to 1,000 vaccines a day through the hospital next week. And hopefully we can offer it to anyone who qualifies very quickly.
How about for those of us who sometimes feel like they're 65 years old when they wake up in the morning? Any hope for us?
Yeah, you don't quite qualify yet, but we'll get to that in a second. So Phase 1B will be next, and of course that includes currently the school systems, any what's considered essential frontline workers, some first responders that may not have qualified yet, corrections officers, food and agricultural workers, U.S. postal workers, manufacturing workers, grocery store workers, etc. That's Phase 1B.
Is there any rough feeling as to when Phase 1B may be open, or is it really taking it week by week until those in charge feel it's appropriate?
Yeah, that's a good question. And our experience so far is it's kind of a weekly thing. The governor, I think they look at kind of how many vaccines they've given out and also the demographics of that population, that age range, and then they open it up kind of in a phased approach. But it's really a week by week thing. I would estimate this current phase will probably last 2 or 3 weeks, maybe a little bit longer. Again, we're real excited at the hospital to be able to get to the 1B phase. It's possible, the governor's been known to do this before. There might be someone who's not traditionally in 1A, and rather than opening 1B, he'll just move someone else into 1A. I heard this week on a conference call that the school systems may get moved into 1A sooner than later. We have at the hospital have reached out to our local school systems here, and we'll be ready to vaccinate any educators and staff in the school systems pretty quickly, I think, once that's opened up. And that's an important area that we really want to vaccine to quickly. So those are honestly, they're right there front line in education. We've got to keep that going and help keep our kids in school and the folks working there safe. So we're looking forward to that. Then the next phase is 1C, which is basically 16 to 64-year-olds that have high-risk conditions. And then after that, phase 2, which is anyone 16 and older. Currently, the vaccine is not approved. The Pfizer vaccine is not approved for anyone less than 16 years old. They just didn't study that population in the trials, and it's only approved for 16 and older. One other treatment I'm just going to mention briefly that we are doing at the hospital is monoclonal antibody treatment. Folks may recall when Donald Trump contracted COVID, he went to the hospital and he got some monoclonal antibody treatment. That was really kind of the beginning of that. And this became available in our state in November. And we started treating folks at that time. Basically, it's for that high-risk group. As I mentioned earlier, those 65 years and older are at a really high risk of death when they contract COVID. It's around 15% is kind of what the statistic is. 15% of it get admitted. They don't necessarily die, but those that get sick enough to be admitted to the hospital, and about 15% of those 65 and older, as well as in certain conditions. And that's what monoclonal antibody treatment is for. And it's this particular one, bamlanivimab, is made by Eli Lilly. And we started this in November. We've given a total of 604 infusions. It's specifically for those who are high risk of developing severe COVID disease, but they're not sick enough to be admitted to the hospital. In the studies, they found that if you're so sick that you have to be admitted to the hospital, that the BAMLAM actually doesn't help you, and it can sometimes hurt you. So it's really only used for those with a mild to moderate disease who are at high risk of developing worsening disease, and you give it as soon as you can from the time of the diagnosis. You have up to a maximum of 10 days to give it from the time of symptom onset, but the quicker you can give it, the better it seems to work. And so just some statistics that we've had from this. Again, as of the first of the month, we administered 604 infusion, and out of those groups, we've had 24 admissions, which is a 4% admission rate, as compared to an expected admission rate of 15% in that group. So we estimate that we've saved 67 hospital admissions by using bamlanivimab in our community. And out of the group of the 604 infusions, we've had 2 deaths. We would have expected to have 17 deaths out of that group, which is an estimated 15 lives saved by using bamlanivimab. Bamlanivimab and the Regeneron monoclonal antibodies, the other one, those are really the only 2 really proven outpatient treatments for COVID. Other than that, the majority of the treatments for outpatient COVID is kind of like you would for the outpatient flu or other viral illness. There's no really good medicine for it. You probably can read about things like vitamins or vitamin D, B12, B6, et cetera. Those don't hurt, but honestly, they probably don't help a whole lot either. But this therapy has really been shown to really make a difference. This last slide, again, just to show where we are in Greenwood with the use of monoclonal antibody treatment. We're one of the leaders in the state. Might be surprised that Greenwood has been using this just about more than anywhere else in South Carolina. There's a few others, Florence, and down in Charleston, they're using a good bit of it. But in the upstate of South Carolina, us and Abbeville Medical Center have been using it more than anybody else. And during our peak surges, we're very grateful that we had this opportunity to use it to help prevent more people from getting sick and having to be admitted to the hospital. So that's kind of pretty much what I wanted to share with you. I would also like to mention, as far as registering to take the vaccine at Self Regional, just to make sure that everybody knows how to do that. There's 2 ways. The easiest way is just to log onto our web form. And if you go to the Self Regional website, which is just www.selfregional.org, at the top of that page, there's a link that says COVID vaccine page or COVID vaccine information. If you click that, on that very next page, there's a link to our COVID vaccine registration form. You can just fill that out, and one of our associates will give you a call back. Typically, we're getting the most within 24 to 48 hours to give a call back. And we also have a telephone option as well. And that number is 725-3555. And we're answering that phone Monday through Friday from 9 to 5. And again, it's open to 65 and older to go ahead and call now. The 65-year-old crowd will start scheduling next week to try to start getting them in. So, and we'll work through that until we get as many vaccinated with that group as we can. And
now, I call upon our membership, to check on your family members, your neighbors, your friends. Not everybody is internet savvy. Some have gone their entire lives without filling in a single form online. So keep them in mind, offer your assistance, check in on them, ask if they've been vaccinated, encourage them to get it if they haven't, and then guide them through the process, help them fill out the form or give them the phone number to call. But it's incumbent upon us as citizens and neighbors to help others out who may not be as connected as we are.
Absolutely. Yeah. Thank you for that. We, again, for folks that don't have internet access, the telephone is a great option. And again, if you can help your family fill out the web form, that's a great way to get it registered as well.
Dr. Logan, you've answered most of the questions that I had received in advance. I think there's only two that I would like to ask here.
Sure.
All right. So one came from somebody who has a complicating health issue like asthma. What phase do those people fall in, and what's the feeling about receiving a vaccine if you have such a condition?
Sure. So people with asthma, if they're between 65 and 64-year-old, they would qualify in 1C, which is still a little ways out. Now, we definitely recommend they get vaccinated. Folks with any type of chronic underlying lung disease are at higher risk of developing, more of a severe course with COVID if they were to get it. COVID, where it kills people is it causes an inflammation problem within the lungs. And so, as you can imagine, people with underlying lung problems would be at a higher risk. So they definitely should get vaccinated.
Okay. And the second question I thought was interesting. It was asking specifically about self's capabilities, but I guess this could extend to any other testers for being able to identify any of the COVID variants that have been making the news lately, such as the UK or South African strains. Do we have that capability within the county to detect that, should that be seen?
Sure, that's a good question. And what happens is we send some of our testing goes to state DHEC, and DHEC does some surveillance screening on the tests that they receive from around the state. Every single test that we do is not tested for a variant per se, but there are some sampling done at the state level where they'll sample 1% of the tests that come there. And we do send, on certain days of the week, we send all of our tests to DHEC. Other days we run them in-house, but there is there's a surveillance going on, but it's not every single test screening for it. Our tests we run in-house, our PCR-based tests, we'll pick up a COVID positive result from a variant, but it may not identify that it was a variant. You would just get a positive for COVID result.
And the final question, is there anything that we can do to assist the morale of you and the team itself? If pizzas were to find their way to the front desk, would they be turned away? Or is there anything more substantial we can do to help our brothers and sisters working in the hospital get us through over the goal line here?
Well, I appreciate you asking that. And that means a lot that you guys would think about the staff here. We're actually working right now with our foundation, the Self Foundation,
yes,
and to set up a fund if folks wanted to donate to specifically the healthcare heroes at the hospital, and that will, I think, go live probably next week or so.
Okay.
Where folks can do that.
Well, we have a direct line to Mamie Nicholson, so she will make sure we're at the front of the line to contribute to that when it does get opened.
Oh, yeah. And if someone wanted to donate pizzas, we would be welcome, and it will be brought to the staff. So
okay.
That would be fun.
Fantastic. Well, Dr. Logan, thank you so much for your time. This was extremely informative, and greatly appreciate you reaching out to us.
Absolutely. And thank you for having me on today. And say, just spread the word. The vaccine is safe. It is effective. The hospital here, we really feel it's our mission to help protect the community, to keep from getting sick in the first place. But if you do get sick, we're here for you, and we'll do what we can to try to get you back on track.
Great. Thank you. Have a great rest of the morning.
Thank you. You too.